Hello, my name is Emma Remy, and today I'm going to be initiating a peripheral IV access. Throughout this whole skill today, I'll be practicing general principles and safety practices. I'll be doing my 3 checks against the MAR, and I'll be doing my 11 rights of medication administration. So my first check begins with pulling medication out from the MAR and checking our IV solution back to the MAR. I'm going to make sure that it's clean, unopened, and dry, and not expired, which it is. And then my third check is when we go in the patient's room. We're going to get 2 patient identifiers and compare it to our IV solution and our MAR order, and they all match. Now I'm going to assess my patient for any allergies that was not in their chart. So now I'm going to perform hand hygiene and set up my IV solution. I'm going to get my IV solution out of my bag. I'm going to get my tubing out. I'm going to untangle it real quick. My protective pieces are still on both of ends of my tubing. Alright, and now that is done, I'm going to go ahead and spike my bag, maintaining aseptic technique. I'm going to take the IV access port off, keeping that clean, and my IV spike off, keeping it clean, using a twist turning method. Ooh, I'm going to spike my bag. Right now that's spiked, I'm going to flip it over and fill my drip chamber up halfway. Now that it's filled halfway, I'm going to prime my tubing. Make sure there's no kinks in my line. Come over here, keeping my protective piece on so that stays clean. I'm going to unclamp my tubing, looking through my line, making sure there's no air bubbles, no kinks until the IV solution gets to the tip, which it has. So now I'm going to clamp it. Now that my tubing is primed, I'm going to go ahead and hang it off to the side so that it stays out of my way. Alright, now that I have done that, I'm going to go ahead and clean my station up a little bit. Alright, now I'm going to start my IV access. I'm going to perform hand hygiene. I'm going to set up my supplies. First thing I like to do is go to my IV start kit and get some tape. Alright, and now that we have our tape, I'm going to go ahead and set my tegaderm to the side so that we don't contaminate it, treating it sterile. Set it over here so I don't cross it. Alright, and now I'm going to prime my J-loop. So I have my J-loop here. I'm going to open my saline, normal saline, take the tip off, open my package, and grab my J-loop without contaminating our hub. We're going to connect it to our hub without contaminating it. We're going to take our protective piece off because we won't have time to remove that later. We don't want to contaminate it later. So now I'm going to prime my J-loop with normal saline, showing there's no air bubbles. And now since our package is still sterile, we're going to open it and place it in our package as so. Alright, so now that all my supplies are ready, I'm going to perform hand hygiene. I'm going to palpate for a vein I'm going to be using. Alright, and I'm going to be using this vein. So I'm going to perform hand hygiene again. I'm going to don some clean gloves. Well, that glove, we would get a new one from a package. So these are clean gloves. All right, and now that I have done that, I'm going to get my tourniquet out and place it 2 to 3 inches above that site I just selected. Now we don't want to leave this tourniquet on too long, so I'm going to assess for radial pulse, make sure we have good blood flow, and now I'm going to get my facility approved cleanser, pop it and clean according to manufacturer's instructions, and let it dry according to manufacturer's instructions. And now that we have that cleaned, we're not going to touch it. Now I'm going to go ahead and get my gauge for my patient. I'm going to assess the appropriateness of the IV solution with this gauge in my patient's vein. I'm going to use my double OK method. I'm going to hold the skin taut 3 to 4 inches below where we're inserting at. At a 10 to 15 degree angle, I'm going to insert my needle with the bevel side up. And then when I see blood return, I'm going to advance my catheter, occlude my vein. We're not going to touch that site, not contaminate it. We're going to pop the safety on the needle and pop our tourniquet. And to stop the blood flow, I'm going to get my J-loop without contaminating it and attach it. Now that we've got that, I can release of the occlusion because the blood flow is occluded. Now I'm going to go ahead and secure my hub down. Now that that is secured, I'm going to flush my IV site with the normal saline. I'm going to aspirate, check for blood return. Then I'm going to flush it fully with normal saline, assessing the site for any complications such as infiltration. All right, and now that I've flushed that, I can remove it, and I'm going to be cleaning this hub later, so I'm going to just go ahead and secure it down with extra adhesive as needed. All right, I'm going to get my Tegaderm and place it on there. All right, and now I'm going to secure my hub, not taping over my Tegaderm so we don't ruin it. All right, now that my IV is secured and it looks good, I am going to label my IV with anything the facility wants me to. So now that we have our IV access, we are going to set up our fluids to our IV. So I'm going to get this down. Make sure it's untangled. Okay, we have our protective piece still on there. We're going to get an alcohol wipe and scrub the hub. And we are going to let that dry for however long. Now we're going to take a protective piece off, ensuring that we're maintaining aseptic technique when connecting this port to our hub. Now I'm going to connect it, maintaining aseptic technique. All right, now that it is connected and secured, I'm going to release the IV clamp. I'm going to set a flow rate per order and assess that that is appropriate. And I'm going to assess the site for any complications or any signs of infiltration. I'm going to remove my gloves, perform hand hygiene, and then I'm going to immediately document this IV solution. And then I will also check for the right response by the patient and document that as well according to facility policy, whatever they want me to document. Thank you.